Before you do anything else, I want you to hold up one hand and look closely at your nails. Not casually. Not the kind of glance you take while reaching for your phone. I mean a real, deliberate look in a good light. Because in the next few minutes, I'm going to show you something most adults over 60 have never been taught, even though cardiologists and internists see versions of it all the time. Your nails are not just cosmetic. They are living tissue fed by some of the smallest blood vessels in your body. And when circulation begins to weaken, when oxygen delivery starts to fall, when the heart is under strain, those tiny structures can start showing the evidence long before a crisis forces the issue. That is the part most people never hear. They hear about chest pain. They hear about shortness of breath. They hear about emergency symptoms after the danger is already obvious. What they usually do not hear is that the body often whispers before it ever screams. And after 60, those whispers matter more. You're watching Dr. Anthony Fauci Health, and I want to tell you something that genuinely concerns me. Again and again, older adults come in after a cardiac scare, heart failure diagnosis, rhythm problem, valve issue or circulation workup, and when you examine their hands carefully, the clues were already there. Not always dramatic. Not always enough to diagnose anything by themselves. But visible. Quietly visible. Sometimes for months. Sometimes for years. Nobody had pointed them out. Nobody had explained why they mattered. Nobody had told them what to watch. That changes today. And stay with me until the very end, because the last thing I'm going to show you is a simple test you can do on your own hands in less than a minute, and it may tell you more about your circulation than you expect. If this kind of information is useful to you, press the like button now. It helps this reach people who are over 60, living alone, caring for a spouse, or quietly ignoring symptoms because they think it's just aging. And in the comments, tell me your age and whether anyone in your family has had heart failure, stroke, bypass surgery, or a heart attack. I read those comments carefully, and they help shape what I cover next. Now let's get into why your nails can carry this information at all. Your nails grow from a structure called the nail matrix, just beneath the base of the nail. The nail bed underneath is supplied by extremely small blood vessels. That matters because tiny blood vessels often show stress early. They are sensitive to reduced oxygen, reduced blood flow, inflammatory damage, and chronic changes in circulation. In other words, your nails sit at the edge of your body, but they are connected to the center of the story. Think of them as small peripheral recorders. When your cardiovascular system is working well, the nail bed usually looks healthy, pink, and consistent. When it is under pressure, the color, curvature, texture, or refill pattern can begin to shift. Not always because the nails themselves are diseased. Often because the bloodstream feeding them is telling the truth. And after 60, this becomes more relevant, not less. The body has fewer reserves. The heart can compensate for silent problems for years, but not forever. Mild heart failure, valve disease, rhythm problems, low oxygen states, chronic vascular disease, even severe anemia that forces the heart to work harder, all of these can leave fingerprints in places people almost never think to check. So here is the first nail pattern I want you to look for. If the nail looks unusually pale or opaque across almost the entire surface, almost as if the healthy pink has been washed away, but there is still a thin pink or reddish band at the very tip, pay attention to that. This pattern is often called Terry's nails. The nail can look frosted, muted, almost ghostly, with only that narrow strip of color remaining near the end. This can sometimes be seen with normal aging. That is important to say clearly. But it is also associated with chronic systemic illness, including chronic heart failure. The reason it matters is not because one pale nail proves anything. It does not. It matters because when the vascular bed under the nail changes, the usual healthy color distribution can disappear. I once saw an older gentleman, 72, who came in not because he thought his heart was failing, but because he said he felt slower than usual. That was his phrase. Not sick. Just slower. He thought it was retirement, less activity, more naps, normal aging. But his nails had that washed-out appearance with a narrow darker band near the tip. That did not diagnose him. It started the conversation. Further testing showed early heart failure. Not dramatic. Not advanced. But real. And much better caught there than later. Now look for something different. If the nail appears split into two distinct zones, pale or whitish near the cuticle and pinkish, brownish or darker toward the tip, that pattern is often called Lindsay's nails or half-and-half nails. Once you know what it looks like, it is surprisingly recognizable. This pattern is more famously linked with kidney disease, but medicine is messy, and the body does not respect the neat categories people want. Lindsay's nails have also been described alongside chronic congestive heart failure and other long-term systemic stress states. What matters here is the underlying principle. changes in the nail bed color pattern can reflect chronic strain in the internal environment. Do not diagnose yourself from one feature. But do not dismiss it either. Because one of the most dangerous habits after 60 is assuming that gradual changes must be harmless simply because they were gradual. Slow changes are exactly the ones people normalize. The third thing I want you to check is the shape of the nail itself. Are your nails curving downward more than they used to? Do the fingertips look broader, rounder, more bulb-like than they once did? Does the nail almost seem to wrap over the tip instead of sitting on it naturally? If so, you may be looking at clubbing. Clubbing is not subtle once it becomes obvious, but the early stages are often missed because it develops over time. People see the same hands every day, so their eyes adapt. They stop noticing the shift. Clubbing is classically associated with lung disease, but it can also be seen in heart conditions, especially those involving chronic low oxygen or infective endocarditis. It is not a beauty issue. It is not just how nails get when you age. New clubbing deserves medical attention because it suggests that something deeper may be affecting oxygen delivery or vascular signaling in the body. Here is a quick way to think about it. A healthy nail usually meets the skin at a fairly normal angle. In clubbing, that angle changes. The fingertip thickens. The nail begins to look more curved, more dome-like, almost as if the finger has been inflated from within. I've seen adults tell me, "I thought my hands were just getting old." But aging does not explain every change. Sometimes what people call aging is actually adaptation to chronic disease. Now let's move to something much smaller and easier to miss. Look beneath the nail surface for very thin, dark red-brown, or almost black lines running lengthwise, like tiny splinters trapped under the nail. These are called splinter hemorrhages. A single one, after obvious trauma, is usually not alarming. If you jammed your finger, hit your hand, lifted something heavy, yes, that can happen. But if you notice several of them across multiple nails, especially if there was no injury you can remember, that becomes more important. Why? Because unexplained splinter hemorrhages can sometimes be associated with infective endocarditis, an infection involving the lining of the heart or the valves. Not always. Trauma is common, and there are other causes too. But in medicine, context matters. Multiple unexplained splinter hemorrhages, especially in an older adult with fatigue, fever, weight loss, heart murmur, or feeling unwell, should never be brushed off casually. I remember a woman in her late 60s who mentioned dark little streaks under her nails almost as an afterthought. She nearly didn't bring it up. She assumed it was from gardening. But she had them on several fingers, and the pattern did not fit a single accidental injury. That detail led to a broader evaluation, and it turned out she had a valve-related infection that needed urgent treatment. The nails did not diagnose her. They warned us not to ignore the possibility. Now I want you to look at the color of the entire nail bed. Do the nails ever look bluish, purplish, dusky, or gray instead of pink? Not just when your hands are freezing cold for a moment, but more persistently? That is important. Blue or purple nails can reflect cyanosis, which means there may not be enough oxygen in the blood reaching the tissues properly. Sometimes that can happen from cold exposure. Sometimes from temporary circulation changes. But persistent blue nails, especially when paired with shortness of breath, chest discomfort, dizziness, swelling, or fatigue, demand attention. Heart disease can be one cause. Lung disease can be another. Sometimes both are part of the story. The key is not panic. The key is respect. Because blue or dusky nails are not a cosmetic curiosity. They are a color change in living tissue that may be telling you the bloodstream is not doing what it should. There is another detail most people ignore completely, the half-moon shape at the base of the nail, the lunula. For many people it is easy to see, especially on the thumbs. For others it is faint. That alone is not a problem. But significant changes in the lunula can matter. If it becomes unusually red, unusually blue, or seems to vanish over time while you are also dealing with fatigue, weakness, breathlessness, or other symptoms, it is worth mentioning to your doctor. A red lunula has been described in association with heart failure and other systemic conditions. A bluish one can raise concern about oxygen-related issues. A very diminished lunula, especially in the setting of anemia or malnutrition, may matter because severe anemia places stress on the cardiovascular system. When blood carries less oxygen, the heart has to work harder. People often think anemia is separate from the heart. In practice, the two can become tightly connected, especially later in life. I saw a patient whose daughter noticed that the little half-moons on her mother's nails had almost disappeared compared with old family photos. That observation led to blood work and a cardiovascular evaluation. The result was not a dramatic emergency, but it was meaningful, significant anemia and strain that had been building quietly. Again, the nails were not the diagnosis. They were the clue that something deserved a closer look. There is one more visual feature I want you to notice, and it is easy to confuse with harmless ridging. Look for horizontal white bands running across the nail, parallel to the base, that you can see clearly but not feel when you slide your finger over them. These are often called Muir's lines. They are linked more directly to low protein states and hypoalbuminemia than to heart disease itself, but that still matters. Why? Because older adults dealing with chronic illness, frailty, liver disease, kidney disease, or prolonged systemic stress can develop these changes, and those same conditions can place serious burden on the heart and circulation. This is one reason a good doctor never looks at the body in isolated pieces. The nails, the swelling in the ankles, the breathing pattern, the pulse, the skin color, the blood pressure, the fatigue, they all belong to the same story. Now I want to show you the simple test I mentioned earlier, because this is something you can do right now. It is called the capillary refill test. Hold one hand at about heart level. Use the thumb of the other hand to press firmly on the nail of one finger for about 2 seconds. You will see the nail blanch, turn pale as the blood is pushed out. Then let go and count. 1,000. 2, 1,000. In a well-perfused fingertip, color should return quickly. If it seems repeatedly slow across several fingers, especially in an older adult who is also noticing fatigue, cold hands, dizziness, swelling or shortness of breath, that is worth paying attention to. It does not diagnose heart disease. It does not tell you exactly what is wrong. But it may suggest sluggish peripheral perfusion, which is medical language for saying blood is not reaching the tissues as briskly as it should. Do it on 3 different fingers. Then do the other hand. Be honest with what you see. This is the practical framework I want you to use from now on. Take your hands to a window in good natural light. Look at each nail slowly. Check the overall color. Is it healthy pink, or washed out blue, purple, or oddly pale? Look for that narrow reddish band at the tip that can make pale nails more meaningful. Check whether the nail seems divided into 2 clear color zones. Look at the shape. Is the nail curving more than it used to? Are the fingertips broader? Look under the nail for those thin dark splinter-like lines. Look at the half moon near the base and notice whether its color or visibility has changed. Then perform the capillary refill test on several fingers. And then do one more thing most people never do. Take a clear photo of both hands in natural daylight today. 6 months from now, compare them. A year from now, compare them again. Gradual changes hide in memory. Photographs are honest. They let you see whether something is actually changing or whether your mind has been smoothing it over. If you notice one subtle sign and you otherwise feel well, bring it up at your next appointment. If you notice more than one sign, or a sign paired with symptoms like breathlessness, chest pressure, swelling in the legs, dizziness, palpitations, fainting, unexplained fatigue, or reduced exercise tolerance, do not sit on it. Call your doctor's office sooner and explain exactly what you noticed. And I want to say this clearly before we close. Do not use this to diagnose yourself. That is not the purpose. Nails can reflect many different conditions, and some changes may be harmless, age-related, or caused by something completely unrelated to the heart. Your job is not to play cardiologist from your kitchen table. Your job is to notice, document, and raise the question. That alone can change outcomes. Because the people who get help in time are often not the people with the most dramatic symptoms. Sometimes they are the people who paid attention early. The ones who caught the quiet clue. The ones who did not dismiss what the body was trying to say simply because it said it softly. So tonight, or first thing tomorrow morning, look at your hands again. Really look. Not with fear. With attention. Your nails have been sitting in front of you your entire life. They have been recording changes in blood flow, oxygen delivery, and systemic stress day after day without making a sound. What most people lacked was not the warning. It was the ability to read it. Now you have that. Use it.